distinguished guests, and online participants around the world. It is my great pleasure to meet you. I'm Kwon Sun-man, Professor of Graduate School of Public Health at Seoul National University. Organized by the Ministry of Health and Welfare and Ministry of Foreign Affairs and hosted by the Korean Foundation for International Healthcare and the Korean Health Industry Development Institute, this fifth special webinar on COVID-19 for policy and technology sharing is being held. At the end of last year, the very first COVID-19 confirmed case was reported, and since then, the spread increased significantly. In Asia, Europe, and North America, the infection has been somewhat contained, which is a good signal. But the other regions, especially the African continent and Latin America, are still suffering from the virus going rampant. So due to this COVID-19, there will be so many people who are suffering from much difficulties, and I send my words of support and encouragement to you. I hope we can cheer up. This webinar has been prepared to share what has been contemplated by the Korean government and what kind of policies has been unfolded by the Korean government. And this kind of sharing will be an important effort which will allow us to fight the COVID-19 altogether, and I hope that this webinar can make a good contribution to the global community to that end. So you can learn a lesson from our past experiences, and we are also more than happy to learn anything from you. So this is a place where we can share anything on COVID-19 response. Up until mid-March, the number of confirmed cases had increased continuously, but thanks to the efficient policies, we were able to control the spread to some degree, and the social distancing campaign was in place. And early from this year, we switched this campaign into the distancing in daily life campaign so that we can manage this infection in our daily life without doing intensive social distancing as we did in the past. This fifth seminar will offer 5 presentations. The first speaker is from the Ministry of Health and Welfare, and the speaker is going to talk about the national policies on COVID-19 response and current status. And the next presenter would talk about the roles of municipalities, which is critical in responding to COVID-19, as you well may aware. So we have Mr. Park Kani, Director General of Sangnok-su District Health Office at Asan City, and he's going to talk about the roles and activities that has been done by the municipalities in Korea. Also, one of the key elements of Korea's response to COVID-19 was the ICT utilization. So, from the Ministry of Science and ICT, we have a guest who's going to talk about how Korea has been using science and ICT technologies in order to have a good response to COVID-19. The fourth presenter is from the Ministry of Interior and Safety, and he's going to talk about the self-quarantine management strategies of Korea. Last but not least, the final presentation will be about the Korean National Police Agency's response in controlling infectious disease control and prevention. At the end of the presentation, we will have a Q&A time together. So while listening to presentation, if you have any question, please join us and ask any question to us. For smooth proceedings, when you ask a question, please direct your question to a specific speaker. Especially for this fifth seminar, as we are doing communication with the international community, we realized that who do we need to invite and who are most wanted by the global community. So we prepare in that end. And simultaneous presentation is being provided in 4 languages: Korean, English, Russian, French. So please pick any channel you like. So, before we begin, we will listen to the opening remarks of Vice Minister of Ministry of Health and Welfare. Please. Distinguished medical workers, government workers, this is a time where we need a special support and solidarity, and it is my great honor to welcome you through this video. The world is facing the crisis that we never have seen before because of the COVID-19. This crisis taught us that people on this planet are a community of the same destiny, interlinked through the power of solidarity and exchange. While experiencing the COVID-19 crisis, Korea has worked hard not to forget that globalization and pluralization are two core principles of a democratic society, and accordingly strive to come up with a new concept of responding to this epidemic. For example, Korea has guaranteed international traffics and exchanges as much as it can while fighting COVID-19 to the fullest to stop the spread. Non-Koreans and Koreans have been protected without any discrimination, and the central government efficiently share the burden with the local government, and medical workers and citizens actively participate in this effort as well. In addition, Korea is utilizing every capacity it has to make the best out of advanced, innovative technologies. To manage confirmed cases in contact, self-health checkup application and IT tools were used, and in-car COVID clinics and walking through clinics have allowed us to collect specimens in a safe and rapid manner. Thanks to this effort, Korea fortunately has witnessed a stabilization as the number of newly confirmed cases begun to decline. But I think it is too early to remain complacent. Korea will maintain the readiness and remain vigilant going forward. Before the world develops an effective therapy or vaccine, we will not be able to go back to the days where COVID-19 never existed. This is why we need to redefine normal daily life in a sustainable manner. Followed by a strict social distancing campaign, a less strict distancing in daily life campaign has just begun. To protect peoples on the earth, we need to remain vigilant and make continuous effort together. Until we can meet in person and share what we have, this kind of web seminar and remote video conferences will be a tool where health industries and medical communities around the world timely share all information. One slogan of the social distancing campaign was, "Our physical distance may seem far, but our psychological distance is closer than ever." As such, I'm physically far located from you, but as a part of this community of the same destiny, I will contribute to the enhancement of international cooperation and solidarity. Thank you, Vice Minister, for your kind opening remark. Let us begin the presentation from now on. The first presentation will be given by Director General Son Young-rae of Strategic and Planning at the Central Disaster Management Headquarters, and he's going to talk about the national policy on COVID-19 response and current status, response system, and medical support. Please.
I'm very pleased to meet you online. I am Yong-rae Son, in charge of strategy and planning. I'll address overview of national policy on COVID-19 response and current status. The health care system of each country and its response to infectious disease are determined based on unique social cultural features, so our experience may not be fitting to all nations, but our experience may give you some insight. First, the confirmed cases according to the time sequence. On January 20, Korea saw its first confirmed COVID-19 case. The rate of infection was 1 case per day until February 18th, when 31st patient attending Shincheonji Church of Jesus was found as confirmed case. The number of daily cases increased sharply to 813 on February 29th. After seeing a steep spike, new cases began to decrease. On March 28th, the number of recoveries were larger than those confirmed cases. As May 21st, 723 people were treated in quarantine, while 10,135 patients were cured. This is the status of May 21st. Total of 11,122 are confirmed cases, 10,135 fully recovered, 723 being treated in isolation, and 664 died. PCR testing were performed on 788,684 cases, recording 1.4% positivity. By regions, patient outbreaks were concentrated into regions Daegu City and Gyeongbuk Province, with 8,200 cases confirmed. This is due to the massive infection occurred in Shincheonji Church of Jesus, a special religious cult group. Shincheonji Church of Daegu has become COVID-19 hotbed, causing around 7,000 new cases. Next is the patient's age and death distribution. In case of Korea, cluster infection occurred in special religious group called Shincheonji Church. Among all confirmed cases, 2/3 is accounted for by a single religious group. Thus, there are many young female in their 20s were infected. The case fatality rate is about 2.35%, which is quite low compared to other countries. The distributions of fatality is similar to that of other countries and increases with age. CFR is 25% in patients in their 80s, 11% in their 70s, 2.7% in their 60s, which is the average level, 0.8% in their 50s, below 0.2% in their 40s, showing quite low CFR. Let me touch upon the governance structure of public health response. In Korea, there is a separate government body dedicated in responding to the infectious disease called KCDC. When there is new epidemic outbreak, KCDC exercise leadership as a control tower in dealing with infectious disease. The government agencies are reorganized into a total support system to respond to infectious disease. Headed by the Prime Minister, Central Disasters and Safety Countermeasure Headquarters is set up, comprising the Ministry of Health, the Welfare, and mobilizing restorations of medical systems and other ministries to reinforce cooperation. Each local government also forms its own local disaster and safety countermeasure headquarters. The KCDC, the central and local governments, hold meeting every morning to organically cooperate and to collectively respond to COVID-19. Details such as the status of the confirmed cases, current risk are promptly disclosed every day, and counseling is provided through specialized call centers and local health center. This is step-by-step public health response. First, when there is a new case, fast and accurate epidemiological investigation is performed. Utilizing IT, we track down the movement of patient and disclose that information. Then we promptly identify and isolate people who were in contact with. To prevent the spread of virus, epidemiological investigation and contact isolations are among the most important. However, the disclosure of whereabouts of confirmed cases, after a certain time, we delete that information completely. Second, early detections. In Korea, PCR diagnostic tests were developed from early stage to do as many tests as possible. Screening center to collect specimens were built in area. These enable Korea to test far more patients early and promptly. Also, considering the unique characteristics of asymptomatic COVID-19 patient, massive number of tests were conducted. When a new case is confirmed in densely populated facility, tests are performed on people working on the floor or in that building. In case of nursing homes and care facilities, when there is a confirmed case, it is essential to test everyone. This extensive testing can screen and isolate asymptomatic patients, thus containing the spread of coronavirus. Treatment of COVID-19 cases are classified into severity of the patient. COVID-19 spread rapidly, infecting many, while many patients suffer mild symptoms that do not require hospital treatment. If all positive patients are admitted to hospitals, the medical system will not be able to handle and collapse. In Korea, about 10% is severe cases who are hospitalized and treated, while 90% are mild cases. Thus, they are treated at the living and treatment center by medical staff. This prevents excessive concentrations of patients at hospital, thus containing infections to medical staff. Medical system for non-COVID-19 patients is also important. National Safe Hospital is operated where movement of respiratory and non-respiratory patient is separated. Receiving prescriptions over the phone and by proxy is also permitted. Lastly, Korea does not ban entry into Korea for all foreign nationals except those from Hubei, China. Under special entry procedure, it is mandatory to verify contact information and residential addresses of the inbound travelers, who must install self-diagnostic app on their phones to monitor symptoms. As COVID-19 spread widely from April 1st, First, all inbound travelers entering Korea are subject to 14 days quarantine from their arrival day. Let me now touch upon the key response policies chronologically. In light of increasing number of confirmed cases among inbound travelers, crisis alert was raised to orange from yellow on January 28th. From February 7th, the testing criteria is expanded so that the test can be conducted at the doctor's discretion. At that time, there were only 20 cases. On February 18th, after 31st patient was confirmed, the number exploded to 100 to 200 cases per day. The government raises alert level to the highest and pan-national support system is set. Recognizing the coronavirus spreading widely among Shincheonji church members in Daegu, we identified 9,000 members who underwent mandatory self-isolation. On top of that, all 9,000 members received testing rapidly. For about 2 weeks, all cult members were tested and patients were found. With ongoing cluster infections, we started social distance campaign from February 29th and asked for public cooperation. The public voluntarily refrained their movements, which dropped to 55% of the usual level. For 10 days, there were more than 5,000 cases, out of which 90% is mild cases with no need for hospital treatment. Accordingly, from March the 3rd, the treatment system has fundamentally changed. Mild patients are admitted to living and treatment center where they are taken care of by medical staff. In addition, from March 4th, new testing facilities such as drive-thrus are expanded and Korea maximized testing peak capacity as many as 18,000 tests a day. Thanks to these activities, the COVID-19 outbreak peak began declining. As the number of the patient outbreaks decreased steadily from May 6, we shifted to distancing in daily life. This scheme helped the public stay safe at work and do their daily activities. Let me explain what this is about. The scheme is a nationwide social campaign to balance daily and economic life while maintaining public safety. So, concept of balancing is important. In Korea, there are 3 phases of social distancing. When the COVID-19 spread as epidemic, first phase is distancing in daily life. Second phase is social distancing. When situation worsened, the third stage is intensive social distancing. In principle, distancing in daily life means opening door for economic activity while preventing disease by observing the quarantine rules. Second phase called social distancing, which restricts or allow limited operation of high-risk facilities and public institutions operated by the government, while recommending the public to refrain from unnecessary public gathering and travel. Third phase is intensive social distancing, which in principle bans social gathering except for essential activities, especially going to densely populated facilities. It does not mean that we are imposing forced lockdown or closure. The government presented recommendations and guidelines, while most of the public complied the recommendation voluntarily. As a result, movement was reduced by half. Transition to everyday life quarantine scheme is reviewed at the end of every 2 weeks to determine either to continue or move to strict level. As disease control evaluation index, we review the following indexes. First, fewer than 15 new confirmed cases per day. Second, the number and the size of the cluster outbreaks, less than 5% of cases of unidentified transmission routes. And third, the patient ratio within the disease control network and the basic reproduction number of the COVID-19. This is more detailed descriptions of the distancing in daily life, which means balancing daily lives and economic life while the public complying with the basic rules for individual infection prevention and quarantine. Citizens learn and practice basic rules either individually or by community groups. This slide shows 5 basic rules and 3 supplementary rules for individual infection prevention. Of course, these basic rules cannot completely block or contain the COVID-19 from spreading. Probably, Korea might continue to experience the sporadic spread of COVID-19 in the future, but we are bracing for such risk. However, the practices and participations of the citizens will slow down the spread and reduce scale of COVID-19. The quarantine authorities operate an extensive sample surveillance system for high-risk group and hospitals. The goal of this surveillance system is enabling the citizens to early detect slower COVID-19 spread with smaller in its scale. If you detect early through rapid epidemiological and aggressive diagnostic tests, infection can be isolated and contained from society in its early stage. Distancing in daily life, citizens' practices, and early detection systems of quarantine authority, when these 3 elements are operate organically, I am convinced that COVID-19 will be manageable and controlled by Korea's medical system. I am confident. In early May, cluster infection was reported among about 100 people after visiting clubs in Seoul, causing secondary and tertiary infection occurred in many public facilities such as church, workplace, and hospital. The size and speed were remarkably small, and through thorough epidemiological investigation, the spread is under control. Korea managed to flatten the curve of new COVID-19 amid nationwide legislative general election, Easter, public servant exams, thanks to the public complying with the quarantine rules. We are confident that as we accumulate numerous achievements in the new quarantine system called distancing in daily life, our everyday life in post-COVID-19 era is possible. Based on this experience, we have gradually reopened school and students are coming back to schools. This summarizes principle for COVID-19 response taken by Korea. First, there was no border control or closure of inbound or outbound travelers, nor any lockdown or business closure like other countries. Second, the government tried to disclose transparent information via briefings held twice a day. While there were no panic buying by the citizens, rather they showed trust and confidence in citizenships. Citizens voluntarily participated in the government social distance campaign, which produced same result as physical lockdown of 14 countries. Third, Korea provides universal health coverage through the NHI, enabling all citizens to access high-quality medical services. The cost of testing and treatment of COVID-19 is provided free of charge through health insurance by the government. This is true not only for Koreans but also for foreigners. This system has contributed greatly to provide swift testing and provide treatment for COVID-19 patients. Fourth, central and local governments join forces with all of their strength and respond with solidarity and cooperation. In addition, the medical community and the public actively cooperated with the government. In a nutshell, the whole nation collaborated and responded in unison. Lastly, we actively developed creative and effective tools by utilizing state-of-the-art technology, especially when dealing with unknown new infectious disease. It is critical to come up with creative means to respond as we go step by step. In that sense, Korea actively utilized cutting-edge technology to successfully and continuously respond to COVID-19 in creative way. This concludes my presentation on Korea's response to COVID-19. Details will be presented by other speakers. As I mentioned before, the situation and healthcare system of each country varies with unique socio-cultural system. But I hope my presentation can be useful in your response to COVID-19. I wish all the best luck to all of you in your fight against COVID-19. I sincerely hope that you come up with a great result. Thank you.
Thank you, Mr. Son Young-lee, for your presentation. As you know, Korea didn't employ the close down policy while efficiently responding to COVID-19 virus. So there are multiple core elements of the government's response. For example, governance, structures, and key policy measures have been expounded by this presenter. Thank you. The next presentation will be about municipalities' roles. Of course, the central government is important, but the role of municipalities is critical as well, especially at the local level. What kind of contact tracing has been done by the government? This will be presented by Director General Park Geon-hee of Sangnok District Health Office at Asan City. Please. Distinguished guests, I'm Director General Park Geon-hee of Sangnok District Health Office at Asan City. Through today's web seminar for colleagues around the world, I'm going to share Korea's experience of contact tracing of COVID-19 cases, and it is my great honor to have this chance. Before I begin, the definition of a district would vary among countries, so let me define it first in the context of Korean Administrative Division. Korea's population is around 15 million, and there are 254 district health centers across the country. Each district health center is responsible for the population of 30K to 400K, and my center, Sangnok-su Center, is responsible for 360,000 citizens. Korea's response to COVID-19 at district level follows this 8th edition of guideline released from the key CDC. Each district of Korea plays these major roles in the response, including risk communication and health education, surveillance, coordination and laboratory testing, contact tracing, self-quarantine management, and local level resource mobilization and allocation. Among these, I'm going to focus on this contact tracing for my talk. To allow the district health centers to fulfill their aforementioned roles, in February 2020, Korea escalated the infectious disease alert level to serious, and consequently, district health centers organization was revamped. Before the reorganization, there were two divisions, health policy and health promotion, but they were reorganized into two teams, the response team and the supporting team. The response team now undertakes enhanced infectious disease management work, which includes the contact tracing task. On the other hand, the supporting team also received new tasks, including the establishment of COVID-19 clinics, self-quarantine monitoring, and call center works. To allow staff to efficiently perform these new tasks, 3 refresher trainings were given. First, in order to enhance the center's infectious disease management capacity, 2 officers were newly appointed as an infectious disease surveillance officer on top of the 2 existing officers. The 2 new officers received on-the-job training from the 2 senior officers, and if the number of confirmed cases increases, more officers will be allocated as a surveillance officer. Second refresher training is about contact tracing. For officers working for other divisions, the center taught them how to investigate CCTV footages and identify close contacts. They do their daily works in normal situation, but when a confirmed case is identified, they forge a temporary investigation team to trace close contacts. Third, self-quarantine management related education was offered. For officers working for other divisions, the center taught self-quarantine rules and how to use self-quarantine application. Now let me get into details of contact tracing investigation. The contact tracing process first starts from a basic epidemiologic study and moves into a formation of a contact tracing team, identifying close contacts and disinfecting location visited by the infected, disclosing trace data, and monitoring the contacts. These steps were all made based on the Act on Infectious Disease Prevention and Control. First, when the COVID-19 test result came out positive, the test center reports the case to a district health center through online system or by phone. Once notified an officer responsible for the infectious disease monitoring at the center fill out this basic epidemiological questionnaire on the slide and upload it to the online system and all the way down to municipalities and key CDC. This questionnaire tells the subject symptoms, date of onset, complications, number of family members contacted. Next, how to organize a contact tracing team. When the questionnaire is uploaded online, the relevant province appoints a team leader for epidemic intelligence service. While waiting for that team leader to come, an officer responsible for monitoring at a district health center calls the confirmed to collect more details about their past movements. The officer tells them to recall the past at least 2 days before the onset of any symptoms, where they went, with whom they were, and writes it like a diary to collect further information. Based on the data gained from this initial investigation, the scale of a contact tracing team is decided. If the confirmed went too many places, more team members would be assigned. Otherwise, only 2 to 3 officers are usually enough. With this initial study on the past movement, a contact tracing team goes to the places visited by the confirmed in person, led by team leader. If the confirmed visited high-risk areas such as medical facilities or nursing centers or a place where a considerable number of contacts is expected, KCDC, rather than the province, take a lead in organizing an investigation team for further investigation. Next, identifying close contacts. The team goes to places visited by the confirmed in person and look into CCTV footages, if any, to identify close contacts. The distance from the confirmed, contact time, mask wearing, ventilation condition of a space are all considered to classify close contacts among people in the CCTV footages. If consented by the confirmed, the team can look into the history of their credit card use, which tells exact time of visit, helping the team focus on more specific time frame. If there is no CCTV, the team has to rely on interviews with the confirmed or people worked nearby. Usually, a diary-like information initially written by the confirmed gives the team sufficient information to identify major close contacts. However, before this team visit, a disinfection needs to be done first. After the disinfection, the team wears basic protective gears like masks and gloves provided by the government and proceeds with the investigation. In case when disinfection is not sufficient to remove the risk, but still an investigation needs to be done right away, the team wears level D protective gear and other head-to-toe gear and begins the investigation. A decision on temporary close down is decided by the team leader depending on the exposure level to the virus and characteristics of a space. When close contacts are mostly identified according to the Infectious Disease and Prevention Act, the result of the epidemiologic investigation must be disclosed through social media or the city official homepage or webpage to the public. The team doesn't reveal all past movement, but only places where there could be more contacts unidentified. It means that the disclosure is allowed when more contacts need to be identified and the benefit of the disclosure are greater than non-disclosure. Of course, any personal information is de-identified in all processes. Next, management of close contacts. Once classified as a close contact, a local district health center delivers them a notice of self-quarantine so that the receiver can stay at home for at least 14 days from the date of contact. Along with a notice, an officer responsible for self-quarantine calls them to inform self-quarantine rules. As you can see on the slide, you need to stay in a place isolated from even your family members, and you need to eat alone and use a bath alone. These are the rules. If the place they live in is not favorable for self-quarantine, the city government provides them with another place like a hotel room for them. When a self-quarantine period begins, a local district health center sends a quarantine support package, including thermometer, mask, hand sanitizer, and garbage bags. A food box is also delivered, helped by the welfare division. 2 times a day, a self-quarantine officer calls them to see an onset of any symptom, and if symptom is found, they conduct a COVID-19 test readily. Finally, points to be discussed. Comparing to Europe or the US, Korea showed a lower number of the daily confirmed cases, and some may say that thanks to such small number of cases, this thorough tracing was possible. Or some might have struggled from a scarcity of resources and agonized how to conduct this tracing investigation out of such limited resources. Despite such difficulties, all countries need to find as many close contacts as they can so that anyone identified can self-quarantine, and this tactic is essential to stop the spread of COVID-19. Even in a country where CCTV, credit card, GPS data is not available, unlike Korea, a simple diary-like questionnaires would tell a lot of information where they went and who they were with, like family members or colleagues. And this will allow them to quickly self-quarantine and limit the spread. Also, if a country cannot afford an in-depth investigation on the entire places, it at least can concentrate on close, crowded, high-risk areas like medical facilities, nursing centers, or call centers to conduct thorough close-contact investigation, and it will prevent the infection against high-risk groups or massive spread. Therefore, each district government needs to have flexibility in terms of personnel allocation. Any public health-related organization needs to be ready for reassignment of jobs, and if needed, non-expert public officers can be used as a contract tracing officer. If it is not still sufficient, medical or public health student or retirees from any medical field even can be utilized temporarily for contact tracing. Finally, during the investigation and information disclosure, personal information and human rights must be taken seriously. Some may request transparent, quick, detailed information disclosure, but some others may worry about serious personal information infringement. Striking balance between the two is critical. As a matter of fact, the National Human Rights Commission of Korea once recommended the government to pay more attention to this protection of privacy and human rights. Thanks to your kind listening, these 4 experts are greatly contributed to my presentation, and please allow me to acknowledge their support. Thank you. Thank you, Director General, for your good presentation. You taught us how the government, especially at the local level, managed the COVID-19. You talked about the roles of district health centers and the past movement investigation of the confirmed cases. And at the very last, he mentioned what kind of struggles need to be further resolved going forward. Especially as I was listening to his presentation, at the first onset of outbreak of the coronavirus, the government reshuffled the organization to rapidly respond to COVID-19, and that was quite impressive change. The next presentation, the third presentation, will be given by Director Lee Chung-won of International Cooperation Coordination Division at the Ministry of Science and ICT, and he's going to talk about response to COVID-19 with Science and ICT and how the government efficiently utilized those technologies. Please.
Hello everyone, I am Chung-Won Lee, Director of International Coordination Division, Ministry of Science and ICT. Today, I'd like to share with you Korea's experience in responding to COVID-19 with science and ICT. Korea is tackling COVID-19 in various ways such as prompt and rapid testing, tracing, treatment, social distancing along with quarantine system. Today, I will highlight how science and technology and ICT were applied in conducting testing, tracing, treatment, and social distancing. COVID-19 has posed great challenges and hardships to Korea in the past 4 months. On February 29th, Korea reached a peak of daily case count. Due to the Korean government's proactive and transparent action and voluntary participation of citizens, the number of daily new cases was quickly reduced. First, let me touch upon the COVID-19 testing. From the early stage of coronavirus spread, Korea aggressively and widely tested in short period of time. To minimize damage caused by highly infectious coronavirus, massive scale of testing is essential, with R&D support and emergency approvals for medical devices. So Korean government has helped companies quickly develop and bring the test kits to the market. Currently, emergency approvals for test kits were given to 7 companies. Companies such as Season use high-performance computing and AI to significantly reduce development time. Korea's AI-based medical image analysis companies such as Vino and Lunit, through AI learning using large-scale chest X-ray data, have developed small devices that can detect in just few seconds the abnormal lung conditions of major symptom of corona patients. The AI-assisted devices are connected to portable X-ray equipment in COVID-19 screening centers or ambulances to transmit corona patients' lung photos to medical staff. Second, let me focus on COVID-19 tracing. In order to effectively monitor people in self-quarantine, the Korean government has developed SelfQuarantine Safety app. The app has 3 main functions. First function is self-diagnostic function. Users conduct health check and submit self-diagnosed report using the app to the official in charge. Second function is to prevent possibility of violation of self-quarantine orders. GPS-based location tracking is available. And the third function is to provide the necessary information, including self-quarantine guidelines and contact information, to the government officials. This is very effective program in monitoring people in self-quarantine and making them stay in the designated locations. Information submitted through this app is not shared with others for privacy protection. Contact tracing is extremely important part of epidemiological investigation. In February, as the number of confirmed cases surged, the workload of epidemiologists sharply increased. As a way to analyze large amounts of data quickly and accurately, the Korean government has developed an epidemiological investigation support system. The KCDC operates these systems in close cooperation with police, telecom operators, and credit card companies. By analyzing real-time data such as GPS and credit card transaction history, the system quickly depicts the travel histories of COVID-19 patients very swiftly. Meanwhile, we pay close attention to protect personal information. For privacy protection, this system is used and operated under extremely strict rules. Only a small number of officials with authorities are granted access to this system according to their duties. Activities of each user is under strict surveillance to prevent abuse of personal information. When COVID-19 fades out, all personal data stored in the system will be completely deleted. Now, let me tell you COVID-19 treatment. In order to develop COVID-19 treatments and vaccines, the Korean government is making efforts including R&D support. Institute for Basic Science (IBS) has an RNA research group which completed analysis of all RNA transcripts produced by host cells in SARS-CoV-2. This research provides high resolutions and very detailed and specific gene map of SARS-CoV-2, which will be used for understanding the principle of SARS-CoV-2 replications and thus treatment development. This study was published in the international journal called Cell in early April. To fundamentally tackle COVID-19, finding treatments and developing vaccines are critical. First, let me talk to you about research for drug repositioning. The drug repositioning study aims at identifying effective drugs for COVID-19 among the existing drugs. As the safety of the existing drugs are well proven, application to patients is possible through clinical trials. The government formed a drug repositioning consultative body where industry, academia, researchers join together to carry out drug repositioning study. Among 2,500 candidate drugs, Institute Pasteur Korea has identified 20 drugs effective against COVID-19, and clinical trials is underway using cyclesonid, which is effective and can be applied directly to lung. Korea Research Institute of Chemical Technology, or KRICT, has conducted large-scale screening for 1,500 drugs. Among them, cell test result proved efficacy of napamostat that has antiviral effect and is currently undergoing clinical trials. The Ministry of Science and ICT, Health and Welfare, KCDC, and Ministry of Food and Drug Safety formed pan-government support platform which actively support vaccine development for private therapies via animal testing and biosafety facilities. In order to respond to COVID-19, through international cooperation, Korean government is pursuing data sharing and research result. Through KOAR, or Korea Open Access Platform for Researchers, allowing open access to full text research and Data On, which is the Korea Open Research Data Platform, allowing register, store, share of research data, we are sharing COVID-19 research result. Through nanostructured technology, we are striving to support the infrastructure for COVID-19 response, such as producing high-performance anti-fog goggles and antiviral face mask. Next, social distancing. For the prevention of pandemic spread, social distancing is extremely important. To make policy decisions, the Ministry of Science and ICT has supported science and technology-based COVID-19 model forecasting. First, a network research experts involved in infectious disease spread prediction was established. Next, we supported free usage of data such as number of floating population based on communication data, overseas roaming information, and statistics of confirmed cases for public purpose. Using these data, the Korea Advanced Institute of Science and Technology, or KAIST, predicted that without social distancing, there is a possibility that the number of new cases might increase up to 4,000 per day. Based on this, it was confirmed that the current quarantine in Korea is being carried out properly. Also, COVID-19 model forecasting served as an opportunity to emphasize the importance of social distancing. COVID-19 closed schools while putting students and teachers in unprecedented challenges unheard of, while shifting us to online education. Including elementary and junior high school students, there are about 8.1 million students in Korea. Central government, local government, telecommunication providers, and ICT companies are all working together to support online education. The Korean government, Samsung, and LG have collaborated to provide 36,000 tablets for free of charge to low-income students. Until the end of May, mobile operators have made it possible for anyone to use educational websites without worrying about data fee payment. To provide information and link support related to telecommunication solution companies, the government has established a website that organizes and provides solution companies by field. In the public sector, virtual private networks and video conferencing are used for remote working. As demand for digital services such as remote learning and working skyrocketed, the government has tested broadcast and telecommunication service providers' emergency response system. Now, let me highlight the facial mask. With increasing people's concern over the lack of masks, the Korean government has allowed masks to be sold through public platforms such as pharmacies and post offices. In order to reduce the confusions and inconvenience of the people while increasing the efficiency of distribution, the government provided the public with real-time data on public mask sales. Through the public-private partnership approach, the Korean government discloses mask data sold in public retail stores, while cloud companies provide cloud and map resources, and app developers use this data to develop and provide information services to the public. Let me now give you my conclusion. Today, I covered the national policy on COVID-19 response and current status of Science and ICT application. As country has different social conditions, traditional culture, medical infrastructure, and all the conditions are vastly different. So, Korean model cannot be universally and uniformly applied. However, I sincerely hope our experience can be useful in your country's response to COVID-19. Korea intends to contribute to international community by regularly sharing our experiences and examples. That concludes my presentation. Thank you for your attention.
Thank you, Mr. Lee Chung-won, for your presentation. ICT has been used in various shapes and manners, and he talked how Korea has been utilizing ICT technologies. The ultimate solution of COVID-19 is therapeutic solutions, and he just mentioned that in his presentation, along with ICT utilization. Also facing coronavirus, schools are also suffering a lot. So what kind of educational impact we will see due to the outbreak of coronavirus was explained by him. Next presentation will be given by Mr. Shin Il-chul, head of self-quarantine support team at the Central Disaster and Safety Countermeasure Headquarters. He's going to focus on the self-quarantine management in his presentation, especially the examples of the policies that has been unfolded by the ministry. Distinguished guests, I'm Shin Il-chul, head of self-quarantine support team at Central Disaster and Safety Countermeasures Headquarters of Ministry of Interior and Safety. I'm going to talk about Korea's self-quarantine management. Each country may have experienced different circumstances, but I believe that Korea's self-quarantine experiences would enhance your understanding on how to readily isolate contacts through a rapid epidemiological investigation, and how to conduct COVID tests, and how to treat patients. First, overview. Self-quarantine means a measure which let a person presumably infected isolate themselves for a certain period of time at a certain place. There are two groups of people who need self-quarantine: contacts and incoming travelers. When a contact of either group is identified, an officer is assigned to them and they receive the notice of self-quarantine. Upon notification, the 2-week period of monitoring them begins, which is an essence of this self-quarantine system. In Korea, the number of self-quarantined reached the highest of 59,918 on 14th April and has been declined. As of 1st June, 38,888 people are being self-quarantined. Next, progress. In Korea, the first confirmed case was found on 20th January, and on 9th February, the self-quarantine task was reallocated from the KCDC to the Ministry of Interior and Safety, leading to the creation of the self-quarantine support team. On 18th February, the 31st patient happened to infect a significant number of people, resulting in the escalation of the alert level and the operation of the Central Disaster and Safety Countermeasures Headquarters. To manage a great number of self-quarantined efficiently, from 7th March, the safety protection application was introduced. At the end of March, all incoming travelers were instructed to self-quarantine mandatorily, which also exponentially increased the number of self-quarantined. K-quarantine characteristics. Korea's self-quarantine has 3 principles of openness, democracy, and transparency. Nationwide citizen participation and coordination between central and local government and IT technology-driven quarantine are the foundation of this K-quarantine. For example, many other countries, in order to prevent the spread, instructed the entire citizens to self-quarantine in the form of the city-level containment measures. On the other hand, Korea maintained the openness not only within the country but also to overseas countries. The containment effort was limited to incoming travelers and contacts, and this openness allowed Korea to remain open. In terms of democracy, Koreans relinquished their individual freedom for a greater society-level freedom. The self-quarantined people and all other citizens voluntarily joined the prevention effort, and at the same time, led by Prime Minister, each ministry and municipalities have had open discussions to come up with better prevention measures in a highly democratic manner. Also, through a self-quarantine safety protection app and other IT systems, information was shared, and these technologies have guaranteed transparency and efficiency of self-quarantine management. Next, major plans ahead. The first plan is a refinement of self-quarantine system. From the 9th February, to allow public health divisions to concentrate on prevention works only, the self-quarantine task was transferred from them to my team, or from the KCDC to the Ministry of Interior and Municipalities. Accordingly, my ministry newly forged the self-quarantine support team, and the disaster management divisions of each municipalities also created their own self-quarantine unit, whose work are monitored and managed by the central My Self-Quarantine Support Team. Also, through cooperation with police, fire, and other relevant agencies, we are working hard to make sure that at least 10 officers can manage one self-quarantined. Second, the designation of a case officer. Once a person is self-quarantined, a case officer is designated, and there are 28,303 such officers across the country. The case officer is a core element of the 10 officers I mentioned previously. Each case officer is responsible for 1.4 people being self-quarantined, and to prepare for a possible uncontrollable spread, 3 backup case officers were appointed for each case officer. The case officer for the 2-week period monitors on onset of any symptoms, and unauthorized leave of the self-quarantined. As you can see on the right picture, they deliver a package of daily necessities and hygiene kit, including thermometer and hand sanitizer. They and resolve grievances of the self-quarantined if any. They strictly follow the rules but try to be as nice and devoted as possible to people being self-quarantined. The third plan is well-known safety protection application enhancement. Since the outbreak of the massive infection by the religious group called Shincheonji Church of Jesus, each case officer in some region back then had to be responsible up to 14 people, and to help them efficiently monitoring people, the safety protection application was developed. This application sends an alert when a person being monitored leaves a designated place without authorization, or users can use this app to inform to their case officers, for example, what kind of symptoms they are developing, like fever or cough. While doing other works, case officers may see these pop-up alert messages. In that case, they either make a call or visit in person to take further action. This app has two versions, one for the self-quarantined and one for case officers. For incoming travelers from multiple countries, this app provides services in 6 different languages. Fourth, management of incoming travelers. At the end of last March, situations outside Korea got worsened, and Korea began to instruct incoming travelers to have a mandatory self-quarantine period. Beginning from travelers from Europe on 22nd May, travelers from the US on the 27th March and onward, and travelers from all countries from 1st April and onward have been subjected to mandatory self-quarantine regardless of their nationality. For your information, the number of incoming travelers self-quarantined from 1st April recorded 3,159 on average daily. For incoming travelers, a special entry process was applied, as you can see on the slide. Upon arrival, they can see this instruction on how to install the application at the airport, and unless they install it, they are not allowed to enter Korea. Once their personal information is entered, a case officer is designated automatically for continuous monitoring. Korea actively utilized advanced IT technologies for self-quarantine management. For instance, this GIS system was used along with the safety protection app previously mentioned, so that users' movement can be displayed on a map in real time. This system allows case officers to know unauthorized leave and visited place from the moment of such leave. The e-visitor log for public places also help officers in case of mass infection to collect cell phone numbers of contacts, so that contacts are informed to get a COVID-19 test right away. The contact numbers are collected through an encoded single-use QR code and used only when needed. Finally, the WPS stands for Wi-Fi Positioning System. The GPS-based safety protection app do not work well inside, so this WPS was employed as supplementary. Thanks to this technology, the accuracy of app reinforced 3 times or more. Next, operation of temporary quarantine facilities. Some people coming from Wuhan, China, and other overseas countries were self-quarantined at these quarantine facilities. The number of people used at these temporary facilities reached 1,521, coming from 4 countries. In addition, for foreigners who do not have a domestic address, a temporary shelter has been operated, and the number of people living in these shelters is 1,296. These temporary shelter for short-term stayers also testify to the openness principle that Korea has maintained for overseas countries. For those who have difficulty in finding a place for isolation, including foreigners staying in Korea for long, there are 86 shelters operated by municipalities as well. Next, management of unauthorized leave. Unauthorized leave has been controlled by the Safety Protection app, enhanced legal requirements, and the safety band. The Safety Protection app recently was updated and new features was given to this application so that a motion sensor can detect unauthorized leave even when a user intentionally leaves his or her cell phone behind at home. Those who left home from a designated place without authorization are required to wear the safety band. Their cell phone communicates with the band through Bluetooth, and an alarm turns on when the distance between the two devices exceeds a certain set point or if the band is damaged. Recently, Saudi Arabia agreed to buy 100,000 bands. In the past, for the first unauthorized leave, an officer simply gave them a disciplinary warning, but now we do not tolerate any unauthorized leave, and penalty-related legal requirements have been reinforced as well to stop the unauthorized leave. For example, one Korean received a sentence of 4-month imprisonment, and some foreigners were arrested by police. On top of that, 17 were deported, meaning that the judicial authorities now do not tolerate unauthorized leave anymore. From now on, I'm going to share some interesting ideas developed by municipalities during the process of self-quarantine management. First, some incoming travelers staying at home for self-quarantine were helped by municipalities so that their family members can stay at nearby hotels at reasonable cost, a place called No Worry Shelter. As of 2nd June, 13 municipalities are running 159 such shelters. Some municipalities rented a fleet of camper vans for incoming travelers to prevent the spread among family members. Also, since they need to be isolated for at least 2 weeks alone, a plant growing kit was given from municipalities to help them maintain good psychological health and do not suffer from corona depression. This idea is now being utilized by the central government as well. Also, the app is not usable unless you have a cell phone. Therefore, 11 municipalities rent a cell phone to a self-quarantined free of charge. Finally, I'd like to share some statistics which symbolizes the achievement of key quarantine. The first number represents a total number of people self-quarantined as of 2nd June. Domestic contacts are not required to install this application, but they voluntarily did. This 91% app installation rate was achieved through their cooperation. Unauthorized leave rate was only 0.16%. This achievement would not have been possible if it were not for 65,546 case officers working strictly yet generously at each municipality. Going forward, we will continue to work harder with 5,546 case officers so that key quarantine and key response can contribute to the global eradication of COVID-19. Thank you. Thank you, Mr. Shinil Chur, for your presentation. He talked about the self-quarantine management and what roles did it play in responding to COVID-19, the workforce you need, and how and what kind of ICT technologies you need for self-quarantine management. He talked about multiple facilities utilized, and the thing that was most impressive was that during the 2-week period of self-quarantine, the psychological stress might occur So the plant growing kits were given so that they can grow vegetables and heal their wounded mind. So also he talked about the wristband called safety band, but this is not mandatory for the entire people. Only those who did unauthorized leave are required to wear it. If you have any question, we are accepting any questions from our Q&A page. And the last speaker is Mr. Seo Byung-gyu, Director General of Public Situation Control Center at Korean National Police Agency. Role of police is critical. So he's going to talk about how police played a role in this response. Please.
Hello, everyone. I am Byung-gyu Seo from Police Situation Control Center, Korean National Police Agency. On behalf of Korean National Police Commissioner, I'd like to express my gratitude to participants from around the world. Amid the global fight against COVID-19 pandemic is ongoing, the special webinar is held and I'm very honored to make a presentation today. Under the title of Korean Police Countermeasures in COVID-19, I'm going to talk about Korean police system responding to COVID-19, principle in response and legal basis, supporting epidemiology investigation, tackling illegal activities and its investigation, police role in securing face mask distributions, and protecting officers from infection. Korea's response to COVID-19 is centered on the Central Disaster Safety Countermeasures or CDSC headquarters, as other speakers mentioned. The CDSC headquarters is participated by Ministry of Health and Welfare, KCDC responsible for infectious disease, also the Ministry of Interior and Safety responsible for disaster management, and all the other ministries and local governments, as well as Korean National Police Agency. Led by Commissioner General to support policy decisions of the CDSC headquarters, we operate COVID-19 Police Disaster Countermeasure Headquarters. For your reference, the Korean police is a nationalized system with 18 provincial agencies and 255 police stations. With the three principles, openness, transparency, and democracy, the Korean government is responding to COVID-19 through three T's. T stands for trace, test, and treatment. Under the government response principle, the police secures effective implementation of Infectious Disease Prevention Act while filling gaps in disease control and prevention, including quarantine control and epidemiology investigation, immediate support and protections of human rights, so-called four principles. The reason why Korea is hailed as a model in its response to COVID-19 is because of its outstanding quarantine and policing activities in prevention of epidemics. Due to different laws and systems in each country, the concept of police in full support to quarantine may be unfamiliar. So let me now explain the legal basis for Korean police to participate in quarantine activities. Act on Infectious Disease Control and Prevention provides legal basis for our response. First, the Act provides the basis for police support in quarantine activities. Article 42 stipulates that public health and authorities and head of the local governments may request the chief of the competent police stations to provide cooperation necessary for quarantine, such as investigation, diagnosis, isolations, treatment, and hospitalization. Therefore, the chief shall comply the request. Next, it is the basis for epidemiological investigation support activities such as confirming the locations of confirmed and suspected cases. Article 76-2 stipulates the Minister of Health and Welfare, mayors, governors, and heads of the local government may request the head of the police agency to provide location information or confirmed or suspected cases. In this case, the head of the police agency relayed information from telecom operator to the relevant authorities. The Act on the Performance of Duties by Police Officers provides legal basis for police duty executions. Article 5-5 stipulates that police officers may take necessary actions, including warning to related people and evacuating others if there is a risk of death or bodily harms. Article 6 stipulates that police officers may stop others' action when there is urgent case where risk of death or bodily harms might occur. Article 7 states that police officers may enter building, facilities, or vehicles to prevent danger in life and physical body. Article 8 stipulates that police officers may inquire and verify relevant authorities the facts related to police business. The Administrative Procedure Act stipulates that all ministries and offices must support each other and respond to requests for assistance. Article 7 stipulates all ministries and offices have to support each other to facilitate implementing their duties. Article 8 states when help can be requested. The Act stipulates that ministries and offices have to cooperate unless it hampers severely their own work. In conclusion, the Korean police support activities are legal-based and exercise of police force is strictly controlled by the law. Let me now elaborate police support to epidemiology investigation. First, locating suspected cases. When police receive requests to confirm the location of suspected or confirmed cases by the health authorities and local government, we comply and identify the location based on the Act on Infectious Disease Control and Prevention. After receiving official requests from the related agency, we trace. However, time is essence in response to infectious disease, so priority is given to the work than any other task. Through the Epidemiology Investigation Support System jointly developed by the Ministry of Science and ICT and CDC, whereabouts are gathered and results are sent automatically by electronic, thus significantly reducing the time needed for tracing. The location confirmation and tracing are done as follows. When someone tests positive, health authority retrace the patient's recent movement to find, test, and if necessary, isolate anyone the person may have had contact with. When the health authority requests for tracking through 112 emergency call, the person's cell phone GPS data is confirmed and the police is dispatched with health workers to find person. If the mobile phone is off or GPS is inactivated, then police quick response team consists of detectives and policemen verify actual locations of the person through investigations with cell phone registration records, credit card records, and CCTV footage. Now, tracing movement of confirmed cases. When the prior movement of confirmed cases is unclear, public health authorities request for police checking. Then, the police reply with the analysis of the movement based on the GPS data from mobile carriers. To date, the Korean police have confirmed the location of 13,432 people at the request of the health authorities and provide travel information of 1,743 people. Next, Police Quick Response Unit operation. The KNPA has Police Quick Response Unit or QRT. The QRT is composed of investigate, detectives, and officers of foreign affairs totaling 8,559. The QRT retraces unaccounted subject using with cell phone registration records, credit card records, and other investigation tools. In mid-February, spike of confirmed cases in Daegu city of religious cult group exploded. We had a crisis that reached its peak. At this time, the police quick response unit quickly located 9,029 people who refused testing, and every single one of them were tested, thus stabilizing the crisis promptly. In early May, when cluster infection in Itaewon Entertainment Club spread around Seoul, the QRT located 6,085 who visited the Itaewon Club and identified their movements to contain the spread of infection in a dense metropolitan area. Support to quarantine control. The health authorities are ordering the confirmed cases or those contacts to self-isolate for 14 days at the designated place, including their homes. Travelers who arrived from April the 1st are placed under self-quarantine for 14 days to prevent the influx of viruses from abroad. Health authorities and local government jointly inspect self-isolation. The police monitors self-isolation at the request of the relevant authorities. Through GIS, Comprehensive Situation Control System utilizing Korean ICT, with the consent from people in self-isolation, police traces their location in real time using this system. If police detects walk away from quarantine, location of the subject is identified and that information is handed over to the health authorities. Next, public order in living and treatment facilities. The Korean government provides hospital beds to severe cases preferentially, while mild cases are treated at temporary treatment facilities under the care of medical staff. Temporary living treatment center is operated to monitor inbound travelers from abroad and for people who cannot stay at their home for self-quarantine. The police have provided security for internal and external order at those facilities. From the time when Living Treatment Center was established in March until now, total of 26,000 police are dispatched. After 2015 outbreak of Middle East respiratory syndrome called MERS, the Korean government has revised Act on Infectious Disease Control and Prevention, which provides legal basis for all quarantine activities. The Act stipulates civic responsibilities and administrative order to restrict gathering and movement. Ensuring the enforcement of this law is important duty for the police. Violations of self-isolation and quarantine, submitting false information, breaking the ban on public gathering, refusing testing, hospitalizations and treatment are regarded as illegal activities violating quarantine. The police strictly investigate this violation to ensure that the people comply with the Act on Infectious Disease Control and Prevention. Since January 20th, the police cracked down violation of self-isolation committed by 359 offenders, quarantine violation by 13 offenders, provisions of false information by 23 offenders. In mid-February, as coronavirus spread throughout Daegu City, public outcry over a lack of face mask ran high as grave social issue. Some have exploited this situation, buying up all facial masks to making undue profits or advertising as online sellers only to disappear after receiving the payment. Joint task force among 6 central and local government agencies, including National Tax Services and Ministry of Food and Drug and KNPA, dispatched 182 police investigators to crack down market distortion activity. Apart from Joint Task Force, Police Special Investigation Team was formed with 1,245 officers to curb market disturbances. As a result, the police arrested 282 offenders for buying up masks, 404 offenders for fraud mask sales. We also confiscated total number of 13.6 million masks hidden in their warehouses, and we distributed them to the market. With police effective support, we overcame mask supply and demand crisis and is now supplying stably. Protecting and preventing policemen from infection is extremely important. The Korean police set out guidelines for wearing PPE or personal protective equipment for on-site. And in situations in which contact with a confirmed person is suspected, we must wear level D protection suits such as full body suit and 95 face mask, full body PPE, gloves, overshoes, and hair caps. At present, the Korean police have secured about 90,000 PPE protective clothing and have them in patrol cars, police investigation vehicles, and offices. Also, all field police officers are required to wear a facial mask. From January 20th, when the first positive case was found in Korea, 11 million masks were distributed to field officers. In particular, masks are distributed to field officers, one for each working day. All police stations, people have to undergo temperature check, including visitors and staff, before entering the building. Hand sanitizers and thermometers are in every entry points, elevators, and common areas for self-check. Thorough disinfection in police facility resulted in only 16 confirmed cases out of 140,000 police officers. COVID-19 is a common enemy threatening all humankind and our peaceful life. The Korean government and KMPA are in a war against COVID-19 for the past 143 days. The Korean government and the police will exert their best efforts to protect people's lives and secure safety. Efforts will not be spared to help the international community to surmount challenges. Thank you.
Thank you, Mr. Seobyeom-gyu, for your invaluable presentation. As you know, the COVID response team are mostly based on actual law. So compliance to legal requirement is critical. That's why police officers is such a critical element of the Korea's response. On top of that, at the beginning of the corona crisis, police played a role in distributing masks evenly to public citizens. At the very end, he left impressive remarks. Because around the world, police officers are exposed to high risk of infection. And in Korea, 140,000 police officers working across the country, but only 16 confirmed cases was found among police officers, which is quite an impressive number. So, I invited all the speakers on the stage, and we received the questions from the participants all around the world. So we will begin the Q&A session. So since we have a limited amount of time, I'll ask a question to each presenters, one for one, and go another round of Q&A session. Mr. Bakani, the first question is from the viewpoint of lower income country, the public health system is not sound. This is quite a general question, but so that was a question. So thank you so much for your question, and I believe that I do understand why you asked the question. I can sympathize with you. And as you're listening to the presentation of my country, you might think that this kind of technological advancement must be acquired first, and you need acquire enough workforce to this kind of jobs. You might think like that, but GPS and CCTV and other advanced IT technologies are being used in Korea. However, without such advanced technologies, like I said before, writing a simple diary by a confirmed case would be enough. Where you went and who do you meet with and who you were with you, like colleagues or family members, or if a confirmed case went to a critical place like a nursing home or medical places, you need to find that by having an interview. oral interview with the confirmed cases, and after that, you need to have a good self-quarantine tactic. So, in a place where the healthcare system is weak, I think these tactics can be fully utilized. And some people might have a difficulty in doing self-quarantine. For example, if you have many family members, you need to find an isolated place from your family members, and if it is not available, you need to do as much as you can to isolate the place for eating within your home. And if that is not available, maybe your family members can go into the neighboring places or the place of your kins so that you can do better self-quarantine. Thank you so much for your answer. So for countries with a weaker healthcare system, there are effective measures still that can be taken by those countries. Next question is for Mr. Lee Chung-won. So you devised the real-time epidemiology application, how it was developed, and you discovered and disclosed the past movement of the confirmed cases, and did you see any privacy issues because of this real-time epidemiological application? And did you encounter any privacy issue when disclosing the past movements of the confirmed cases? Let me give you my answer. Korea's epidemiological investigation support system was questioned. Korea's epidemiological investigation support system looks into the credit card use and communication history to trace the past movements of the infected rapidly and accurately. The 2015 outbreak of MERS made Korea revise its Infectious Disease Prevention Act, and this revision laid an institutional foundation for scientific epidemiological investigation. So, based on such revision, credit card and communication companies are legally required to provide requested data. Also, the Ministry of Science and ICT in 2017 launched the data flagship business to design procedures and guidelines of using credit card payment data for epidemiological investigations. So that is another technical foundation we laid. At the end of February 2020, relevant ministries and KCDC discussed and reached an agreement on building an epidemiological investigation support system against COVID-19 to understand the past movement of the infected, to identify hotspots and analyze the possible infection networks automatically. You talked about the possible privacy infringement issue, but we do have legal grounds for all our actions. So rest assured. In order to dispel such worries, we are applying strict rules. For example, the data we collected are classified separately so that only a limited number of people can access to such information. And the use of the data is limited only for the epidemiological study of the patients, and this data usage is allowed only during the epidemic period, and afterward all the information would be destroyed. Thank you so much for your answer. So he just said that Korea has good legal grounds, and I believe that as you are listening to the presentation of all these speakers, legal foundation, legal grounds must be first obtained, and that will help you to alleviate your concern on privacy infringement issue. Next question goes to Mr. Shin Il-chul. So you used the safety protection application, how it was used, and what's the difference between the management of incoming travelers and general contacts? In what way do you manage those being self-quarantined through application? What's the difference between management of general contacts and of incoming travelers? The safety protection apps has two versions, one for those self-quarantined and one for case officers. So each user use their own version and download it from Play Store or App Store. And each case officers have their own unique code, and that unique code is given by the case officer to those who will be self-quarantined, and by doing so, the matching happens and the monitoring begins. Twice a day, self-health checkup must be done by a user, and any unauthorized leave will turn on the alarm. I'm not sure whether you can see this application or not, but if you push this button, there are 4 self-health checkup requirements, and if you leave the designated area, for example, you need to input the place of, the address of the designated isolation place, which cannot be changed afterward. And if any unauthorized leave happens, the pop-up message goes to the case officer. Also, what's the difference between the general contacts and incoming travelers? For general contacts, we have maintained the previous management methodology, but for incoming travelers, when they enter Korea, they are required mandatorily to install this application. This is not on a voluntary basis. And they need to input the domestic address they're going to stay in this application, and that address would be given to a case officer. And from that moment, your whereabouts and movement and health status are being monitored by case officers. The rest is the same. To add some more explanation, the case officer application and the self-quarantined application, there are 2 versions, but they are matched by a unique code of a case officer. So only your case officers can look into your information, not others, right? So this is another layer of the privacy protection, I believe. Yes, of course. Also, the location information. When you install this application, you need to give your consent of giving your location information to the administrator. Thank you. The next question is for Mr. 서범규. So, what is the priority of your works in responding to the COVID-19 pandemic? What should be the top priority for the police in responding to the COVID-19 pandemic? Police is working hard to make sure that all the details of the Infectious Disease Control and Prevention Act are fully complied. So we are doing kind of supporting work. Looking back on at the beginning, the police focus on measures which can dispel the social anxiety, for example, fake news clampdown and investigation on mass buying up or panic buying. During the spread phase, we supported epidemiology investigation team and risk groups, for example, discovering past movements of close contacts and supporting people being self-quarantined. During the stabilized period, we patrolled around, especially around the public places, to ensure social distancing and arrest those who violate administrative orders. So to conclude, we are always in line with the government efforts and their priorities as we are doing supporting work for them. Thank you so much for your answer. So the role of police was explained by him, and it was quite impressive because what the policy is doing is in line with the government always. So the police can work in a flexible manner and change priority in accordance with the changing situation. So let me begin the second round of Q&A session from now on. Let me get back to Mr. Park Geun-hee. Among contacts, what percentage of them turned out to be positive? I'm not sure whether this question is a nationwide question or a local level question, but what about the percentage?
그 접촉자 중에서 이제 확진된
Among the confirmed cases,
secondary attack rates로 이렇게 추산하기도 하는데
we use the secondary attack methodology to presume the percentage. For example, the very first 30 confirmed cases was studied by a research team,
확진자에 대해서 접촉자들이 한
and
2,300명 정도 있었는데
2,300 contacts happened out of the first 30 confirmed cases, which means that 0.55% of the confirmed cases turned out to be positive. And among the family members, the percentage was higher, 7.56%. But if you see the Chinese or overseas study cases, the secondary attack rate is within 1% range. Among family members, it is more or less 10%, as far as I know. For your information, those who are doing contact tracing must be designated, and in order to do so, in order to decide the scale of a contact tracing team, you need to first understand the level of social distancing within your society and other variables. For example, Korea at the beginning saw the happening of the 30 confirmed cases, but at some point the confirmed cases got lowered down to 10 or 20, but if you see the recent cases, besides exceptional cases, the daily confirmed cases turns out to be positive is around 20 because we have a good social distancing policy in place. But the exact number should be further analyzed by KCDC. So I believe that it is too early to tell exact statistic numbers because we need to more accumulate the data, and the situation is constantly changing. And let me get back to Mr. Lee Chung-won. So what kinds of efforts were made for therapy and vaccine development in Korea? Therapies and vaccines are being developed by Korea as well to discover unknown benefits of existing drugs. From the end of February, the Korea Research Institute of Chemical Technology, Pasteur Research Center, Korea Research Institute of Bioscience created a consultative body for drug repositioning. From March, the body conducted a screening study to validate the efficacy of candidate drugs at cell level. Also, they embarked on an animal model project to evaluate the efficacy of discovered drugs by the Korean Research Institute of Bioscience. And in April, Industry Research Institute, Academy, Hospital jointly established a nationwide support team for therapy and vaccine development. And through this joint effort, and each relevant ministry are working hard to give support for vaccine and therapy development. So for this development, private sectors need to play a partial role, and the government need to provide proper supports for private players as well. So it is critical to give good support from the government to private players, he said. Next question goes to Mr. Shin Il-chul. You said that case officers are of a great importance. Can you elaborate why they are important? And what are the specific duties of case officers? So what is the role of the government officers in charge of COVID-19 quarantine? Can you explain the roles and in a more detailed manner? In order to fight COVID-19, epidemiological study must be done to find close contacts, and you need to collect the specimen for test. And isolation is a prerequisite. Otherwise, you are wasting your effort. So isolation and quarantine must be done, and those are being done by case officers. But this case officer system, I believe that only exists in Korea, not much outside of Korea. And we have more than 10,000 case officers who are monitoring the symptoms of the possible confirmed cases and unauthorized leave. And they sometimes visit the people being self-quarantined to check their compliance and explain them how to install application. On the second day, they deliver a package of self-quarantine, for example, food or other ingredient they might need to live for the 2 weeks, not to mention the hand sanitizers. Also for mental health, they are providing other supports as well, emotional supports. And if a case officer is out of the office for urgent matters, the backup case officer is always there to help the original case officer. For example, if those who are being isolated lost their parents and they need to go to a funeral, because considering the culture of Korea, going a funeral is a must for a son or daughter. So before they see their parents went inside of the coffin, they need to give at least some partial time so that they can express their condolences to their parents. And sometimes a child who needs the care of the others must be self-isolated, and in the case officers go there and give some delicious food to encourage child being self-quarantined. So they are doing not just their works but other works day and night, because unauthorized leave happens not just in day but during the nighttime as well. So they need to be strict in some point, but they need to be generous as much as they can on the other hand. So the role of case officers is critical, and the existence of the case officers might be an extra burden for public servants. But for citizens who are being self-isolated are greatly encouraged and helped, because they are the one who are the most close to them in case of self-isolation. So this is kind of close public service given by municipalities. So I believe that the effect of it would be enormous. So the next question goes to Mr. 서범규. In your presentation, you partially mentioned because we do have ample supply of protective gears, but in case of overseas, they suffer from a lack of enough protective gears. So how does the KMPA find a balance between fighting COVID-19 and acquiring enough protective gears? If they do not have enough protective gears, what is your recommendation for the shortage of protective gears? Yes, in the case to protect police officer, we need some measures. In case of pandemic, the shortage of protective gears harms the police and the general citizens as well. If you don't have enough protective gears, you need to move in a very strategic manner, because we need to supply those protective gears first to none other than medical community. Among policemen, those who work at the scene needs the protective gear the most, so they should be the top on the supply list. So that's why we provided the protective gear to those who are working at the scene the first. Also, the right use of protective gear is critical too. So that's why we distributed guidelines so that they can conform to basic rules of using protective gear. To stop the spread among policemen, we always tell them to wear masks, wash hands frequently, have good social distancing, and take enough rest when they feel bad and go to clinic. So these are basic rules they need to stick to. This concludes my answer to your question. Thank you. So those who are working at the forefront must be the first on the supply list. Since we have more time, I think I can go another round of question and answer session. These speakers kept their limited time for presentation very well, so that I can have another round of question and answer session. To Mr. Park, what is the average number of contacts per confirmed cases? So the average number of confirmed cases depends on the definition of contacts, I believe. According to WHO, they gave us a general guideline. For example, if you talk with someone for more than 15 minutes, or if you physically contact with them, you are a close contact. But each country might have their own definition of a close contact, which can be stricter or looser. Or sometimes you can be infected even if you're exposed to not for 15 minutes but just for a few seconds. But in Korea, my impression is that the number of confirmed cases is not that large. So we are trying to have a larger definition of contacts so that we can see more and identify more close contacts. That's why the percentage of those who turns out to be positive is low. So I don't have the most updated, up-to-date statistic cases, but if you see the paper I mentioned, for the very first 30 confirmed cases, among 300,000 confirmed cases, only 0.5% of close contacts turns out to be positive. And among family members, only 7.5% turns out to be positive among family members. And this is quite similar to those of other countries because among family members, 10% is the average and 1% among non-family members is average. Yes, so like you mentioned, it depends on situation and the impact varies depending on circumstances. For example, if the confirmed wear a mask, the exposure possibility would be lower. Infection possibility would be lower.
Next question goes to Director Lee Chung-won of Ministry of Science and ICT. What are Korea's experience of using ICT infrastructure to prevent the spread of COVID-19?
experiences of using ICT infrastructure to prevent the spread of COVID-19. 이 질문입니다.
In case of the ICT infrastructure, there are many ways we can utilize, as I have explained before. The most representative cases are, first of all, quickly, promptly, accurately identifying the movement and also the travel history of the contacted person. And for that, all the related government ministries have joined together and also have collaborated to understand their movement. And second, utilizing mobile phones app, we try to find out the status of the self-isolation people, inbound travelers, and also other nationals. Third, recently, I believe that we are talking a lot about using artificial intelligence. So AI-based and data-based, we can carry out a quick monitoring. And also, together with the telecom operator, we are cooperating to find out GPS location. So these are the rough idea, our efforts to contain the spread of COVID-19.
So, like you said in your presentation, the past movement of confirmed cases and epidemiological investigation are of a great importance. He just mentioned on the importance of it once again. And third question goes to Mr. Shin Il-chul. And
발표 중에 또 저도
in your presentation,
말씀하셨습니다만
I also heard that early February, the self-quarantine work was transferred from your ministry to Key CDC. I mean, from Key CDC from your ministry to your ministry. So what are the specific reasons for having the Ministry of the Interior and Safety take charge of home quarantine related tasks since February 2nd, which is around 20 days after the first confirmed case recorded?
Take charge of home quarantine related tasks since February the 9th, which is around about 3 weeks after the first confirmed case was recorded. 가 질문입니다. 예.
네. 2월 초에
Early February,
행정안전부로 이게 자가격리
it was transferred to my ministry, but before that, Key CDC and district health offices were responsible for the management of self-quarantine. The confirmed cases were back then was 28 and 10,184 people were self-quarantined, so it was under our control. But since this coronavirus is very infectious, we expected that further spread, massive spread would happen. So to efficiently use the limited resources, and in order to help the district health centers to focus on their prevention works only, the work was relocated to my ministry because usually the district health offices are good at doing small, intensive works, and my ministry or larger institutions are good at doing larger work in a very organized way. So for that reason, the relocation was decided, and my ministry is responsible for the supervision of municipalities and also supervision of the nationwide disaster. That's why this reallocation was decided. In case of MERS back then, and case officers were allocated from my ministry to manage the self-quarantined people. So because of that history, the job reallocation happened. And there is a Central Disease and Safety Countermeasure Headquarters meeting which decides job allocation, and they always doing some kind of decisions that allows efficient and flexible job reallocations. Each department has their own strengths and weaknesses, so considering those two features, we are doing that kind of job allocations. So back then, that decision was made because the number of the confirmed cases and self-quarantine were not that many, but you moved in a very preemptive manner so that KCDC and district health centers can focus on their expertise fields, while the Ministry of Interior originally were responsible for the disaster management, took the job, and they have a good coordination with the local municipalities. That's why this reallocation happened. Final question.
Last question goes to Director General Seobom-gyu. How does KNPA rearrange their staff members in handling both for fighting COVID-19 and also ordinary police officers?
Rearrange their staff members in handling both for fighting COVID-19 and other ordinary police affairs. 가 질문입니다.
First of all, let me briefly touch upon the working schedules or daily lives of the policemen. 40 hours per week, usually, or in case they work on site, we have 3 shift or 4 shift. And we also have an emergency team, level 1, 2, 3. In case of level 3, if policemen belong that, then 30% of the policemen can be mobilized. Additionally, in case of level 2, 50%, level 1, we can mobilize 100% of the police forces can be utilized for the emergency cases. In case of the COVID-19, when Korean government upgraded or heightened the alert level, once again, all the police forces were notified to work as emergency cases. In the area of Daegu City and Gyeongsang Province, once again, we had this special working schedule, which means that level 2, so 50% of additional police forces were mobilized. When situation worsens, level 1, which means that 100% of additional police forces can be mobilized. So, including the existing ordinary police officers, additionally we can mobilize. That's the system that we have. However, when there's a spike in confirmed cases, we can increase the mobilizations. But when the spike is stabilized, once again, we return the police forces back to their ordinary affairs. During the emergency working hours, we pay additional extra hours. And instead of mobilizing huge forces at one time, we try to allocate necessary forces to necessary regions by regions. That's all. Thank you.
So in case of emergency, he talked about how police mobilize their workforces. So far we have been listening to the presentation and had a Q&A session. So at the very beginning of this webinar, I told you that this webinar is a chance to share what we experienced and also a chance to learn each other, especially today's webinar. What do you think about the speakers? What were your impressions? They are from different departments and different agencies, for example, from Police Agency, from the Ministry of Interior, from the Science and ICT, and also from a district health office, which is part of municipalities. What I want to say is that this composition of speaker tells you that this is a national crisis, the COVID-19, and in the case, if you want to figure out an effective fighting measure, this multi-sector approach, multidisciplinary approach is critical. Let's say that this is just infectious disease, so the Ministry of Health and Welfare need to take a full responsibility, and that's absurd. Not the central government can take the full responsibility as well. So whenever I do this kind of sharing session, I always tell the audience that each country have their own situation. So one success story would not be duplicated necessarily in other countries. Nonetheless, despite such difference among countries, we can deduce common principles that we can apply to all countries. Efficient policy direction, and one of them is multi-sector approach, and that was kind of testified it by this composition of speakers. For example, we have a gentleman from the Ministry of Science and a gentleman from a municipality department and a gentleman from police officer and police agency. So this kind of multidisciplinary coordination is a core element of a good response to COVID-19, and this is a common principle that can be applied to all countries around the world. If I'm allowed to say a few more, they were very rapid in responding COVID-19. At the very beginning, they moved swiftly to limit the number of confirmed cases because otherwise the medical system would have been totally paralyzed. So initial response is critical, and the participation from the citizen is critical to amplify the effect of government policies. And in order to do so, the government needs to be transparent to earn trust from the public. Also, we need to pay some more attention to the socially marginalized people. So I think these are all common principles that can be applied not just to Korea, but to all countries. You might say philosophy or principle, rapid response, and more attention to socially marginalized people, and coordination among different departments. I have so many things to say, but I need to conclude this webinar here. Thank you so much for your kind sharing of your experiences, and thank you so much for your kind participation, the online participant and offline participant. And even at this moment, there are so many people who are suffering from the COVID-19 around the world, the confirmed people.
격려의 말씀.
I send my words of encouragement to you and those who are working day and night to treat them and to control them, the medical workers and civil groups and the governments. Thank you so much for your hard work, and I hope that we can overcome this crisis with our concerted efforts. Today's webinar video is being recorded, and you can access to the webpage of the Ministry of Foreign Affairs to re-watch it. This concludes the 5th special webinar on COVID-19 for policy and technology sharing, organized by the Ministry of Health and Welfare and the Ministry of Foreign Affairs, hosted by the Coffee. Thank you so much for your kind participation.